Welcome once again to Living in the 21st Century. For the second time around, we have Dr. Nadini. She's calling from out of India. A molecular biologist, Mercy, mother of triplets with autism. And we also joining us today is Dr. Francis from right here in Kansas City. Ladies and gentlemen, I want to welcome you again to welcome again to Living in the 21st Century. And today we want to focus our concentration on parenting of autism, or autistic kids rather. And first, my question is going to go out to you, Mercy. Could you enlighten us a little bit what in detail parenting autistic kids are all about?
Thank you so much, Errol, for having us for the second time to share about parenting children with autism. So, wow, how is parenting a child with autism like? It is a completely, totally different thing. I happen to have neurotypical children who are much older, and then my sons who now have autism. So comparing the two, it's actually like day and night. And I will just dramatize this by giving you an example of a comment from a neighbor, my neighbor in the estate where I live. So this neighbor said, Mercy, you are a bad parent because, my sons go outside and they are fighting the others. And I was like taken aback. I said, wow, how am I a bad parent? So I had to highlight to this person that I am not a bad parent. I am mother to 4 other children who are very successful. And my sons have a challenge, autism. And because of that challenge, we have spent more money, more time, more discipline, more of everything trying to bring up these children. So the issue is not about us being bad parenting, but it is because the children have a problem.
Okay.
So in a nutshell, that's the way I would describe it.
Okay. So Dr. Nadini, is it strange for autistic kids to abnormally has a passion for rage than any other kid? Because this seems to me like anyone can have rage or outbursts at any given time.
So children with autism have meltdowns. These are not passion or rages, these are meltdowns because of inability to express what's bothering them. And they have a different language, they have a different way of expressing what they want. And it's not that they are abnormal, it's that we don't know. We don't know what's happening in their world. So they are in a different world, and that's why they have meltdowns and tantrums. So it's not that they are aggressive, it's just the communication issue is an issue. So if you look at children with autism, as they grow, they have problem with communicating in the language that we understand. Their language is different. We don't understand their language, and that is our problem. So we just need to find a way to get into their world and help them come out into ours. So it's not, all children do not have meltdowns. There are, of course, a subset who do have meltdowns because they may have a tummy ache, or they may have a toothache, or they may have a throat pain, and they are unable to let you know that they are having this problem. And that's why they cry or throw tantrum or have a meltdown, as they say. So it is seen that if you are able to help them communicate through verbal or non-verbal methods, then these meltdowns or rage, as you say, will reduce.
Do you believe that stem cell eventually will assist in aiding these kind of meltdowns, or the concept where it's natural for they to have these outbursts? Will stem cell play an integral role in dissolving that problem?
Yes, certainly. So if you look at even neurotypical children who are at a younger age, we do see behavioral issues and meltdowns in neurotypical children also. So what is the difference that we are looking at? What do we want to do to enable children with autism to have lesser meltdowns? Stem cell helps to improve comprehension. understanding, ability to adapt to better surroundings, and to be able to communicate better. As stem cells improve the brain functioning, the severity of meltdowns, the severity of aggression will reduce, because now they are able to, one, self-regulate themselves, control their impulses, and be able to participate in activities much better. As communication, both verbal, non-verbal, improves, these meltdown reduce. So yes, stem cell, along with a good training program or rehabilitation, does help these meltdowns to reduce.
And Dr. Francis, tell me, you are expert into stem cells. Where do you see stem cell in the in this 21st century? Because it seems to me that there were a point where stem cells were the topic of the day, and for some reason it is somewhat being diluted here in America. How would you go about really educating the public at large the benefits and the importance of consistently practicing stem cell research and implementing what methods you would have found that is beneficial to humanity?
Thank you so much again, Errol, for having us again here today. Yeah, stem cells fall into a kind of newer treatment. It's essentially called regenerative medicine. And like we discussed last time, stem cells can have one or two modes of action. So they can either replace tissue that is damaged, so you can have a replacement therapy. You can have a repair therapy, whereby they either help the tissue or the damaged tissue to repair by itself. So there's a whole spectrum of how stem cells work, and this depends on each particular situation, how they work. Now, we discussed also last time that there is both adult stem cells and the pluripotent stem cells. And so using those two approaches, we can have a very wide array of diseases or conditions that can be treated with the stem cells. Now, the science is still very new. Even here in the US, the FDA is still doing kind of a running process. Wow, how do you regulate stem cells? What kind of conditions are treated by stem cells? How do you know that they are effective? So there are certain things that are needed to be qualified for stem cells to be an effective therapy. Number one is safety. Are they safe to be used? So that's the first and primary question that FDA asks. Then the other question is, are they potent? Are they really doing the work that they are supposed to be doing? Then the other question is, how do you monitor them over time and make sure that they continue to work? So there's a whole lot of things that can be treated by stem cells. Like we said, almost all body diseases can benefit from one form of stem cell therapy or the other. So it's a very broad sense. And for example, in this case of autism, these are newer treatments. I think from what Dr. Nadini and Dr. Sharma told us, through their PET scans, they can see that there is improvement even after 6 months of stem cell therapy. So that's one way that you can actually see that they are working and provide ways for the future as well.
Great. Mercy, I want to ask you this question, because here in the US, there are thousands of autistic kids all over the US. But what I found is that there are private schools or where private teachers come into your homes and work with these kids. This atmosphere is somewhat isolated from most other kids at school, but they are still getting equal treatment in the homes where they can stay home, and there are social workers coming to visit them at their homes. They're getting education at their homes with special teachers and so forth. What kind of atmosphere you found surrounds you in Kenya or wherever you are at this point in working with your kids?
So, the scenario that is in the US for parents and children with autism is completely different from what we have in Kenya and in Africa in general. In the US, there is a lot of government participation, And that is completely across board, across providing, like you said, care, the primary care, the therapies that are required, the special education. Even I understand there is some situation where children can be picked and taken out so that they can be able to be integrated or enjoy the social life. But in Kenya, it is me and my God. Each parent with their own children and their God. There is no cashback. There is no provision of assistive devices, because, even for autism, we do have assistive devices, like, for instance, the communication devices. And schools, you find that the government has something they call inclusive education, but this is just a structure of 4 walls. It lacks resources in terms of the physical resources as well as the trained personnel. So it is a very big challenge, extremely very big. It drains the parents, their mental health, their relationship as families. I mean, every sphere of their life is affected in Kenya.
Okay.
So, Mercy, if I may want to follow up on that very quickly. Now, what is the national policy, for example, in Kenya, in terms of autistic kids? And is there activist organizations or bodies that can advocate for autistic kids? And what is the government really doing on this in terms of the health ministry?
Yes, there is actually a lot of bodies, organizations, parents coming together, and I will give an example, a very big society called Differently Talented Society of Kenya, DTSK. So these are groups of parents or professionals who come together and create mainly awareness, autism awareness. That is where we are actually on creating awareness. But for me, I am looking at, we need to go beyond talking about this is autism, these are the symptoms, these are required. Can we move to the next level where we are creating awareness by providing, the resources, the centers that actually do impact on the child recovery? So, when it comes to, we have a body called the National Council for Persons with Disability, which is the government arm that deals with all the disabilities. But what you realize that there is a skewed kind of situation whereby autism and other neurodevelopmental disorders, let me call them the invisible disabilities, they are completely left around. Even the people who are there don't really understand what is autism. So you find, unlike other disabilities like blindness, physical disability, albinism, which has a lot of government support, autism is so much behind because nobody understands it at the policy level.
And Dr. Nadini, I want to ask this question. I once worked in a mental institution, hospital rather, for close to 2 years. And I found that there were autistic kids there that have a very high IQ, just as intelligent as the normal person. And they're even far superior and better in certain things than other people. And I never understood clearly why they would have been subject to be in an environment called a mental institution. Could you explain that to me? Could it be a misdiagnosis for something else, or that's how the cookie crumbled? I don't know. Tell me, please.
Extremely unfortunate. In fact, long before people understood what is autism, it was considered to be a mental disability or mental illness, a psychiatric condition. With time, it was found, or it was understood to be a neurodevelopmental condition, and that, as you said, there are individuals who are extremely intelligent, they are geniuses. Their only problem is they are unable to interact, social appearances and social interaction is an issue for them. So It is really unfortunate that if you're saying in a progressive country like US that they are in mental asylum, it is very unfortunate. Older, it has been, though it has been seen, the only explanation I can give for such a situation would be possibly if these individuals are not placed properly, they are not occupied gainfully. With older age, they do start getting comorbid psychiatric issues such as bipolar disorders or hallucinations or severe aggression and the meltdowns which we see in younger children. It may happen more often in the older children, older individuals. So that could be the only reason, if at all, I can think that they are in a mental asylum. But that's why it's very important to start intervention very early in life so that they can be, academically as well as socially mainstreamed to be able to be productive individuals in the society, which we have seen is happening with many, many, many individuals now. Acceptance in the society is increasing, though it is not still optimal, but yes, understanding of and awareness of about autism and what it really means, that it is not a psychiatric disorder, it is a neurodevelopmental condition, and individuals can proactively be part of the society and contribute is to be known. This awareness actually parents as well as doctors need to bring out and let the lay public know. There are so many individuals in the history of our life, if you look back, our geniuses had been diagnosed as autism and ADHD and have lived a full life. So it's unfortunate. I'm not sure, Mr. Errol, where you have seen such individuals, but it is unfortunate if that is so.
Well, why I asked that question is because normally I thought it was discriminatory because from a social cultural standpoint, there are a lot of people who are awkward socially among each other, and it doesn't necessarily imply that they are autistic. They may act weird, they may get on weird, they may be withdrawn from society. But we live in such a marginalized society today, is that it would be a shame to have someone being discriminated against and considered mentally disturbed simply because they cannot act like every acceptable person in society, when it may be just a little bit of cultural or social awkwardness. And that's why I asked you which I was surprised that some people who I recognized was far more smarter outside the hospital that were in the hospital for autistic behavior. So I wonder if this word autism in some sense has a stigma of discriminatory on a person simply because they may not be acting normally like you and I.
Exactly. They are different. And when people tell me, will my child become normal like you and me? I ask them, who told you that you are normal or I am normal? This is what we define ourselves as. But we have to look at what is the individual bringing to the society, and how we can harness their potential. That's what we have to look at. It is important that awareness increases because the number of children with autism diagnosed now is increasing exponentially, as we discussed earlier. And there may be a time which will come where I think so-called normal or neurotypical will be lesser and the autistic will be high. So it will be their world then.
Yeah, well, a lot of things to worry me because they're getting treatment and getting medication for autistic behavior, and the side effects are even worse than their behavior. So I wonder if these people are on the endangered species list. Because it's just weird. I just can't begin to imagine why some folks who are far more superior in intelligence are subject to mental treatment simply because they are socially awkward.
Yeah, it is our mistake. We misunderstand them. That's why.
Right. Yeah. So Mercy, I love that name too, by the way. Mercy, let me ask you a question. With your children, I know you're going to show them all the love and all the compassion you find them to be your sweethearts and so forth. But in your culture, they see different. You're called an unfit mother. And this happening simply because your children don't act the way like what they expect normal children to act like. But does that make your children less than the ordinary children?
Absolutely not. In fact, again, I will give an example of my estate. And initially, before the children became much better, they would just get out and get into someone's home, and they would go straight to the kitchen, grab food, and get out running. And because of that behavior, many people in the estate, they were feeling that I should lock my sons in the house so that they don't go to disturb them. And I had to come out very strongly and fight and advocate for my sons, because they are different but not less. They have the right to go outside and play. And if you are very bothered, then maybe it's good you keep your door locked. So definitely they are different, but not less. And it is the parents and the caretakers who really have to come out strong to fight for their children. Otherwise, you will find that they are locked in the house because of these bad behaviors outside, and the parents don't want to keep exposing themselves always with all these altercations of, oh, your child did this, your child did that. But what I have learned with the time, the more so how to overcome it is not to avoid it, is to actually expose them in that situation and show them what is the right way. And with the time, and here time we are talking of years, months, it's not a few times. So yeah, different but not less.
Okay.
I jumping in with a question for Dr. Nadini. I know, just as Aura mentioned earlier, there's a lot of autistic kids in the US, and stem cell therapy is not available for them at this time. Obviously, the FDA is not an approved therapy. Can you talk to what Neurogen and your institute is doing in terms of making these type of treatments more globally available, acceptable, or even any interactions with like the FDA by providing data and other information so that this can be a global approach?
So, see, our mission is, of course, about creating awareness about autism and neurodevelopmental disorders, as well as awareness about the treatment options that are available with us. At this point, we can, I would say, work more towards our local community and our national policies. That's what we are working at. At present, what we are doing is not governed by the US FDA. It is governed by the Indian FDA. And once that is completely regulated, then I think we would be better in a position to approach the US FDA. I think US FDA norms and rules apply more in the US. So there are trials going on, as you would know, at Duke University in North Carolina, where they are doing stem cell. These are cord blood stem cells given intravenously, and they are working on clinical trials. So US FDA is aware. In fact, if you remember, Dr. Sharma discussed about a clause in the US FDA rules also that the cells which are taken from the patient's own body, in fact, can be used to treat patients' own ailments. By the physicians, based on the physician's judgment. So the treatment that is being done at Neurogen is actually in a way acceptable under US FDA guidelines. Mm-hmm. There are various laws, for example, Charlie's Law in Texas, which allows the use of autologous cells in debilitating disorders. And Right to Try Act by Donald Trump actually also talks about use of different for using experimental treatments for various disorders. So there is a possibility, and there is a movement, in fact, in US, where use of your own stem cells for your own ailments is being pushed forth by the citizens of the country. So, and thereby to get it away from the US FDA. So not under the US FDA, but away from the US FDA because these are not drugs. But yes, for the allogenic cells, then yes, you would have to show that use a yardstick of a drug and get the proper procedures approved by US FDA, and that is being done by the Duke University. Yes,
correct. Certainly, use of autologous is kind of the lowest bar, because, like we were talking about last time, the cells are minimally manipulated, and they're going back to the same patient. That's probably the easiest route to approach at this point. Yeah.
Yes, because they are your own cells, and if they are not manipulated, they are just processed, purified, and put back within the same setting of the procedure. Then it is acceptable to use them.
So Mercy, briefly, because we're running out of time, what encouraging word would you want to give mothers or fathers out there who have autistic kids, and how to love them and care for them?
Yeah, so first of all, definitely you have to extend love. You have to do something I call assume competency for them across board, because most often than not, even myself, it has been a process to come to the realization that I have to assume competency for Lenny, Rick, and Eric across board, that they can do this. Because once you assume incompetency, then you cannot even try that. The other thing I would like to say is that I like to call myself a pathfinder, because it was very difficult to accept that there is no treatment, that my sons can be better. And I have found